Hello, my friends and colleagues. Today I am very excited to take a little of your valuable time to introduce a new addition to our benefits program. Over the years, we've improved our benefit packages for employees. And now with the addition of direct primary care, we take your benefits to a newer, higher level. To help me explain the DPC program, I am joined by a very good friend of mine and the founder of Primary Health Partners, Dr. Kyle Rickner.
Thank you very much, Bob. It's so good to be here, and I'm so excited to share with your employees information about their new benefit, direct primary care through Primary Health Partners.
How does direct primary care, DPC, providers differ from the traditional medical care?
Well, thanks for asking that. You know, there are three major differences that we have. Our providers, number one, are available 24 hours a day, 7 days a week to their patients. We leverage technology so they can be available. Second of all, they're taking care of far fewer people. So they have time to spend with them in the office and available to them out of the office. Thirdly, they are cost patient advocates. So they're able to actually look at things from what would benefit the patient the most. And unfortunately, in traditional systems, they just don't have the time to do that.
Is this something new or has it been around for a while?
Well, I'd love to take credit for this, but it really was started in Seattle in the late 1990s. And then I heard about it first in 2014, and we opened Primary Health Partners in 2016. And today we're excited to actually partner with other DPC affiliates around the country and meet the needs of many companies like Funk companies.
Does DPC replace ER, urgent care, or specialist doctor visits?
It sure can, and we hope it does quite a bit. I do tell my patients, if you end up in an urgent care, that's like a personal insult to me, because there's nothing they're going to do for you there that we can't do. And there certainly are a number of avoidable emergency room visits that we would like to take the place of. And we do have the time to take care of patients a lot more than we used to, so we end up taking the place of some specialists. So we would really like to see a reduction in the utilization of all three of those entities on this plan.
Tell me, Doc, how does the 24/7 access work?
Yeah, so our providers are available all the time to their patients. And we do that through a few different ways. We have a patient portal that they can contact the office anytime. There's a secure texting app where they can message their provider after hours. And then we also are available for asynchronous visits, we call it, which are telemedicine visits. We may just do a telephone visit, or virtual visits where we can do a live feed if we need to do that.
I really appreciate your support.
Well, thank you. Thank you for having us and trusting us with your employees. Bob, you've had a DPC membership for some time now, and you seem to be enjoying the benefits of it. Tell me, why do you have a DPC membership?
I love the DPC membership because they're very responsive. They're customer service oriented. They get you in quickly. They take care of your illnesses and take care of your issues that you have, and are very responsive to the needs that I had.
So Bob, tell me, how's the DPC plan benefited you personally?
Well, when I had some illnesses, I was able to call even through the middle of the night to get help. I believed that I needed help at that time, and the doctors were extremely responsive to what my needs were, and they were communicative, and they would call back immediately to give me some help.
So Bob, why did you decide to add DPC membership to the Funk Company medical plan?
Well, we've always been interested to have the best medical program we possibly could obtain for our employees. And of course, the cost is a factor as well. We want to save our employees' funds, and we want to save the company money as well. And DPC furnished both of those for us and gave us the opportunity to have more benefits with lesser costs, and that certainly helps the company and helps the employees. But the employees come first.
So Bob, based on your own experience, how do you think DPC will benefit your individual employees?
Well, what I've found that they have easy access, and it lowers the employees' cost, and that's the important thing. And of course, building a relationship with your doctors and your providers is very important and gives you a lot of comfort and security that they're interested in you. And I found DPC to be that firm. Doc, I want to thank you for working with us on the DPC program, and I want to thank you for joining us today. It's always a pleasure to chat with you, and I appreciate your program.
Bob, it's always a pleasure to chat with you. Thanks for having me.
Likewise. To explain the enhancement to our benefit packages, I would like to send it over to our very own Darla Green.
For those of you who are new to the company, or maybe we just haven't had the opportunity to meet face-to-face, I have the privilege of managing employee benefits for Bob's companies, collectively known as the Funk Companies. The purpose of this meeting is to explain a unique enhancement to our medical plan called Direct Primary Care, or DPC for short. The network of DPC doctors we use in our medical plan are called Kempton Direct Access Providers, or KDAP for short. So you may hear us use KDAP or DPC interchangeably. Let me introduce you to our panel of experts. First, we have the CEO at Primary Health Partners, Rocco Wicks. We also have two KDAP physicians joining us, Dr. Tana Shaw and Dr. Lacey Anderson. They are here to answer any questions you may have about the KDAP program. Dr. Shaw, can you briefly explain the DPC model for those of us who've never heard of direct primary care before?
Direct primary care is a monthly membership fee for your health care. Beyond the monthly membership fee, there are typically no out-of-pocket costs. You can go see your doctor as many times as you want within a month. You can have televisits with your doctor for follow-ups, and you can even have 24/7 access to your physician. Our whole focus is on the doctor-patient relationship and developing a very strong relationship to help you take better care of yourself and to help us as physicians take better care of you. We minimize your urgent care visits because you do have 24/7 access to your physician, and a lot of times minimize or even really do away with emergency room visits, except for in extreme cases.
Thank you, Dr. Shaw. Rocco, can you help explain the role of primary health partners and how our employees will be able to select a Kempton Direct Access provider?
Yes. The role of primary health partners is to provide your employees with convenient, affordable, and world-class health care. How you sign up is your employees will access the Kempton member portal. Once they've accessed the portal, they'll click on the KDAP link. Once they're on the link, that will start the enrollment process. While they're enrolling, they're going to enter their zip code. Once they've entered their zip code, a list of providers will pull up based on that zip code. So the closest ones that are to that zip code will be at the top. Once you've accessed the Kempton member portal and you've signed into the link, the actual sign-up process takes 2 to 3 minutes. So it's a very easy, seamless process.
Now it's your opportunity to ask the experts. What questions do you have for our panel?
I understand I won't have to pay an office visit copay, but will I have to pay a monthly membership fee on top of my medical premiums?
That's an excellent question. Dr. Shaw, would you mind answering this for the panel?
Yes. So Funk Companies is covering the monthly membership fee for all of the employees as well as your dependents, so spouse or children. But if you have someone who is not a dependent with Funk Companies, you can actually sign up with a direct primary care provider as well.
I can see how this would benefit someone with chronic conditions like diabetes or high blood pressure, but I rarely see a doctor. How would this benefit me?
Dr. Shaw, I know that's a question you can answer.
Oh, absolutely. So for the people who are typically healthy and they don't visit the doctor very often, we do an initial visit. It's typically about an hour long, sometimes a little less, sometimes a little bit more. But your physician gets to know you personally. We learn about your family history, your risk factors. We typically will do some screening labs, and we know you well enough that 6 months later, when you come down with a sinus infection, when you're traveling outside of the state and you need a doctor and don't want to go to urgent care, you can send us a message and you can tell us your symptoms and we can take care of you on the spot. And so there's not really any need for you to go to urgent care. It makes your health care much more convenient for you. It saves you time and it saves you a lot of trouble as well.
Can I keep my current doctors?
Dr. Shaw, can you answer this one for us?
Yes. So we have a lot of people that come to us and they have had long-standing relationships with their physicians and they don't want to lose that relationship or they don't want to sever that relationship. As a direct primary care physician, I can take care of all your primary care needs. I can do, for women, I can do GYN exams. We can really take care of the whole entire spectrum of primary care. If you have a great relationship with your primary care physician or a different physician that's a specialist, I don't want to step into that. You are perfectly welcome to keep that physician. We will work together if we need to, and if you decide that eventually you want to move all of the responsibilities over to direct primary care, we will make that happen. But we understand that relationships are very important, and we want you to keep those relationships that are important to you.
And I'd like to add that if you go to your KDAP doctor, you don't have to pay a copay. Any other doctor you see, you'll have to pay $25 for each visit.
I live in rural Arkansas. Is this only available to Oklahoma, or are there participating providers near me?
Rocco, I'm sure you can answer that for us.
So yes, we partner with affiliate offices. So Primary Health Partners, we have 6 clinics in the Oklahoma City area, 1 in Ardmore, and we're about to open 1 in Tulsa. But where we don't have a clinic, we work with affiliate clinics that provide the same model of care that we do, which is the direct primary care. So if you live in a rural area, you may not specifically be going to a Primary Health Partners clinic, but it will be an affiliate clinic which does the same type of care that we provide.
Will I have to pay extra for services like x-rays or blood work?
Dr. Shaw, can you address that for us?
So my understanding is that the KDAP program is covering blood work for things that you need done in the clinic. There are some imaging studies that we can refer you out for that will be zero out of pocket. There are some x-rays that may be your responsibility to cover at least at some cost, but we negotiate the lowest possible cost so it will be minimal.
How quickly can I see my personal doctor after signing up online?
Rocco, I'm sure you can answer this for us.
So after you sign up, we have a member concierge team which will contact you within 24 to 48 hours. So it's a very quick turnaround. And the whole reason we do this is we want to bring you in for that first hour-long appointment to establish care. Once we've established care, then you'll feel very comfortable with reaching our providers after hours.
What does it mean to have 24/7 access to my doctor? Does that mean I don't have to go to an urgent care or emergency room after hours?
Dr. Anderson, can you elaborate on this for us?
Yes, we actually have an after-hour app called Spruce. So if you need us after hours, if you have an urgent need, you can actually text us on your phone and it will actually go to my phone so I can see your urgent after-hours messages. As far as sending someone to urgent care or the ER, it is my goal not to send people to urgent care or to the ER, but I can guarantee if I think you're having a stroke or a heart attack, we're going to the ER. But I have been able to take care of a lot of things after hours without urgent cares. I can take care of kidney stones after hours. I've taken care of pink eye and shingles and sinus infections and bladder infections after hours. We can call in medicine out of state. If you are in Breckenridge snow skiing and you get sick, I can call in medicine to Breckenridge. If you're about to step on a cruise ship in Miami, I can send medicine to Miami too. So it does keep a lot of our patients out of urgent cares and ERs.
Do you offer telemedicine so I don't have to see the doctor in person every time?
This is a very common question. Dr. Anderson, can you address that?
Absolutely. We actually do probably 25 to 50% of our calls are done by telemedicine. So there are some things that we might need to see people in person for, but a lot of things we can do it over the phone or over a video visit if you prefer. So we can adjust medicine over the phone. We can start antibiotics over the phone. There's a lot of things that I can take care of without having to bring you into the office. Occasionally, we do want you to come into the office if I'm worried about you, or if you have abdominal pain and I don't know what's causing it, I may ask to bring you in. But I think about half of the things that we see could be taken care of over the phone so that you don't have to take off work.
What if my spouse isn't covered by our medical plan? Can he sign up as well?
While employees and their dependents who are covered under our medical plan can sign up for KDAP, anyone can actually sign up for direct primary care. They just have to do it outside of our member portal.
I see how this can benefit the patient, but why do you, as a doctor, like the direct primary care model?
Dr. Anderson, could you answer that for us?
Oh, absolutely. One of the nice things about the direct primary care model is we limit our panel size. So when I was with a larger medical system, I had about 3,600 patients. We limit our panel size to about 600 to 800. So we have fewer patients, which means that patients are allowed to get an appointment when they need an appointment. We have access. We have same-day appointments available. And so that's great for patients, but it's also great for us. It allows us to get out of the office by 5 o'clock instead of being there till 6 or 7 o'clock at night, and to have that extra time to spend with the patients when they need it.
As a doctor, how has DPC changed your everyday practice of being a doctor?
That is an excellent question. In fact, I'd like to ask both of our doctors to answer that. Dr. Shaw, would you like to go first?
Sure. DPC has been pretty life-changing for me. I did primary care for 8 years here in the metro area and left because of all of the headaches from insurance and all of the other struggles that we have. Went into hospital medicine for 13 years until I got to the point where I did not feel like I had enough time to spend with patients to do all the things I felt like were really the right thing to do. And direct primary care allows me to really develop relationships with patients, spend lots of time with them, really get down to the heart of what's bothering them, what their issues are, ordering the right tests and saving them money at the same time. It really has allowed me to sleep better at night. I feel like I take great care of my patients. I feel like my patients are happy. Their questions are answered. Their issues are taken care of within, hours, if not a day or two. And it's really completely life-changing.
It sounds like relationship is the most important thing to you.
Absolutely.
Dr. Anderson, how has this affected you personally?
It's been a wonderful change for me too. A lot of us came from traditional medicine where we were very rushed. We saw 25 to 30 patients a day, and now I see about half that amount of patients per day. I have twice as much time with each patient. So a new patient appointment is an hour instead of 30 minutes, and a follow-up appointment is 30 minutes instead of 15. I feel like we have time to talk to each other about things that aren't related to the appointment, like our families and how we're doing, with our jobs and our careers. So for me, it's been life-changing in that the relationship that I've got with the patient, I think, is closer, and I feel like I have the time to be a better doctor to those patients too.
Thank you for that insight. I'd like to thank our panel for taking the time to meet with us today. I know your time is very valuable, and we greatly appreciate the information you were able to share with us. And I want to thank you all for participating as well. We have amazing benefits at the Funk companies, but they're no good if you don't know how to utilize them. So if you think of any questions that we didn't address here today, please feel free to contact me by email or phone. I'm always here for you.
I was invited to be one of the initial groups to go through the KDAP program. At first, I didn't really understand what I was going to be doing, and then I was given a website. I went through the website process, and the next thing I know, my phone was ringing, and it was actually an invite to go and see the doctor.
Oh my gosh, it was so awesome. It was so simple. I got on the Kimpton group I selected my doctor. I got a phone call immediately.
I walked in the door. There was nobody in the waiting room. It was just me. The lady at the front desk was very kind and sweet. She offered me water. She offered me coffee. I had already completed all the forms. I didn't have to do any completing of forms once I was there. Within a couple of minutes, the nurse came and got me and took me back.
The nurse did my vitals, the doctor came in. It was very simple, very fast, made me feel very comfortable.
I went to sit down, and literally before I sat down, the door opened and the nurse came out. The next thing, I'm sitting there waiting for a doctor, which took probably 30 seconds.
In the visit with the doctor, it was exactly like Dr. Shaw explained in her video. She did give me an hour of time. She got to know me. I felt comfortable being with her.
She was so kind and asked me how I was feeling, started going over my chart. She asked me about my family, if I had kids, if I was married. She asked about my job. She was just so welcoming and made me feel like that I mattered to her.
The doctor sat down immediately. He knew my first name. He laid out his computer. We immediately started chatting about not necessarily my health, which a normal doctor would just turn around and say, how are you feeling? What's the problem? They want to get no, this was, how are you? Have you gone through the process? What do you know about this benefit opportunity?
Yes, I have used the app before, and I sent a text. The nurse responded to me first and got more information from me, and then the doctor responded in no time at all. She sat me down and I had to download 2 apps. One app is for non-emergency cases and one app is for emergency cases. The emergency case will text the doctor directly and she will answer immediately. The other app, I did use it. They felt my blood pressure was high. She asked me to take my blood pressure for 2 weeks, write it down, and then just snap a picture of where I'd written it down, upload it onto the app. I did that, and within 30 minutes, my doctor had answered, sent me a message on the app, and we communicated via the app, and she sent some medication to the pharmacy for me, and I had to start taking medication, unfortunately. But she was very kind, she made me feel so taken care of.
I did receive a text message the next day letting me know that my results were in, that everything was fine, which made me feel better because it was nerve-wracking having to wait on those tests, and it came back the very next day, so it was quick response.
Going through this process, it was immediate. When I walked in, I'm walking in to see a doctor. The doctor asked me, we have a pharmacy right here. Would you like to take your prescription with you? The process is easy, it's quick. It is almost concierge health service, and that is wonderful. And everybody within our company has now access to concierge health services.